public health initiative helped reduce deadly car wrecks in Texas. Can it do the same for gun deaths? That's a question posed by an extensive article today in the Texas Tribune, and Alejandro Serrano from the Tribune is joining us now to discuss this. Alejandro, thanks so much for being here with us.
Thank you for having me. I appreciate it.
Okay, so let's start with a little context here. You examined the public health response to studying car crashes and then the federal government's investment of millions of dollars to develop solutions like airbags and just other innovations that really make driving safer. So this all dates back to the 80s. How do public health experts now, though, believe this same response will really help lessen gun violence in our country?
Yeah, that's right. It's not so much that it's a recent realization as much as it's the CDC tried this in the 1980s. And the thinking was, well, the government tracks a whole bunch of information about cars and car crashes and how people are injured, for instance, where crashes occur, what time of night, who is injured, the extent of injuries. So the CDC tried to start doing this with guns, but ended up meeting some opposition, and then that essentially thwarted a lot of federal funding for these studies. But in recent years, it has picked up again. Now, the federal government's investing about $25 million to fund gun violence studies in the country.
And so you referenced some opposition. What barriers are those public health experts really facing in getting more federal dollars to address gun violence?
Yeah, in the 80s and 90s, the opposition came from a lot of gun rights groups who felt the CDC's studies were pretty much a campaign to take people's guns away. But now with the 25 million, the bigger struggle is kind of getting more money, but that money exists currently, and some institutions in Texas have actually received it to study gun violence here. It's just a matter of getting more money to fund more research. One aspect that people often point to is neither the state or country tracks firearm injury.
And according to your piece, for the first time, this was a pretty staggering statistic, for the first time in a generation, Texans were more likely to die of gunshot wounds than car crashes in 2021. So are there any major current or future efforts really that those public health experts say is happening at the state level as well as the federal level to address this and make sure that solutions are implemented so we can see a change?
Yeah, there are a few things that elected officials point to. One is the current presidential administration created an office for gun violence meant to tackle some of these issues. Last year, Congress passed some of the most sweeping legislation since the 1990s to address gun violence. That included creating new laws at the federal level and also unlocking money to fund programs that help at the local level. In Texas, lawmakers this past legislative session outlawed these switches that make handguns essentially fully automatic weapons, which are already illegal federally, but not at the state level. And they also closed the loophole that let juveniles who had mental health issues as youngsters legally obtain weapons.
Okay, Alejandro Serrano, thank you so much. And we'll have your extensive article from the Texas Tribune on our website at KXAN.com.